My name is Elias Jabbour. I'm at the Soho Houston here, and I just presented data on a PhALCON randomized phase 3 trial in ALL, PH-positive ALL. In fact, in this trial, it's a randomized phase 3 comparing ponatinib to imatinib in combination with chemotherapy. For the first time, the primary endpoint was MRD negativity at 12 weeks. The study endpoint was met. Ponatinib was found to be superior to imatinib therapy. It doubled the MRD negativity CR. This is number one. Number two, we know that more patients stayed on ponatinib, contrasting with imatinib because of lack of efficacy and need for transplantation. We notice as well the treatment is not toxic. In fact, the adverse events were similar between the two arms, and therefore ponatinib was not associated with increased rate of vascular events. We know that patient on imatinib arm went on to receive subsequent therapies for molecular responses, for molecular relapses or resistance. And for this molecular resistance, it was not defined an event for event-free survival. And despite its crossover, the event-free survival was in favor of ponatinib. And we look at the PFS or progression-free survival, it was in favor of ponatinib. Now, of course, the follow-up is still short. We don't have a survival difference. But it's very important to notice as well that there was no increase in the rate of vaso-occlusive events, being arterial or venous, and the treatment was well tolerated. So in summary, the endpoint was met. Ponatinib is more effective than imatinib therapy. It met its primary endpoint, and the secondary endpoint is favorable as well, while it's safe regimen. And therefore, I hope this new drug will be available to everybody as standard of care.